this is Dr. Julie Elner. Welcome to Chapter 2 of my bariatric surgery video. We'll just pick up where we left off in Chapter 1. So what are these diseases that go along with obesity? We call these comorbidities. They're the diseases that ultimately kill people in association with their obesity. So on this list, we have hypertension. That's high blood pressure, high cholesterol, high triglycerides. It doesn't take more than 10 or 15 pounds to push these things up. And the doctors want to give you medications. They want to put you on a special diet. They want to get that blood pressure and that cholesterol under control immediately. And the reason is because those three things, although they don't directly kill you, they lead to heart attacks and stroke. So the risk of heart attacks and stroke goes up even with an extra 15 pounds. But look what happens with the gastric bypass. High blood pressure is back to normal within 48 hours in 90% of patients. Dr. Mason was seeing this back in the 1960s when he did the world's first gastric bypass surgeries. And to this day, 50 years later, we still haven't figured out why blood pressure goes back to normal so quickly. But 90% of my patients who have gastric bypass surgery leave the hospital off of all of their blood pressure medicines, and they have completely normal blood pressure. Type 2 diabetes, we used to call this the adult onset diabetes, but we can't really call it that anymore because now the kids are getting it. But it's the obesity related one. It's not the one that you're born with. That's type 1. It is one of the leading causes of death in the United States because, as you can imagine, as more and more people suffer from obesity every year, of course the number of patients suffering with type 2 diabetes goes up and up and up every single year. We spend more money taking care of diabetics in this country than any other disease. In case you're wondering how much that is, it's $245 billion a year that we spend taking care of diabetics. 1 out of every 5 healthcare dollars in this country is spent in diabetes. And imagine what would happen if we could free up $245 billion from our healthcare budget by wiping out type 2 diabetes. Look at the statistics for the gastric bypass. It's the same statistics as with blood pressure. Diabetes is gone within 48 hours in 90% of patients. We're 50 plus years into doing the gastric bypass and we still don't know why it makes diabetes go away within 48 hours. But these are the statistics that they're seeing in every country in the world that they do gastric bypass. Some of the more recent research has looked at the cancer risk in association with obesity. We're discovering that so many cancers are caused by obesity. The list you see on the left, that's just the short list. There are a lot more cancers that are associated with obesity. One of the things that we're also seeing is that when people lose their weight, their cancer risk drops. So if you're at your normal body weight, you have less than 3% chance at some stage in your life you're going to get a cancer. But look what happens with obesity. It jumps to 52%. But when you lose the weight, that cancer risk plummets as well. Every year, I diagnose cancer in maybe 2 or 3 patients because they have an obesity-related cancer that they had no idea about. Gallstones and liver disease are very common amongst people struggling with their weight. A lot of people know that gallstones are associated with people being overweight, but a lot of people don't understand what fat actually does inside your liver. Fat accumulates around on our arms and our legs where we can see it and we know it's there, but what we don't see is how it gets into the inside of some of our organs. It completely encases the heart. It can get all the way around the intestines, but it gets into the inside of the liver. Now, the liver is a big filter. It's a detoxifying organ. You can't live without your liver. It takes away all the excess kind of byproducts that your body makes during normal digestion and metabolism. So you can't live without a liver. But what happens when fat gets into the liver inside, it causes inflammation and it clogs up the filter mechanism. So your liver starts to fail. But it causes inflammation inside the liver that causes fatty liver disease or fatty liver hepatitis. And fatty liver disease is the most common liver disease in this country. It can actually progress to cirrhosis, which is irreversible. cirrhosis can lead to liver cancers. And when people get cirrhosis, they get put on a liver transplant list. The nice thing is that when you lose weight on your body, you lose fat out of the liver as well. So the fatty liver hepatitis is all reversible as long as we've caught it in time and helped that patient lose weight before the hepatitis turns into irreversible cirrhosis. This is Mike. Mike came to me many years ago with a lifelong history of obesity. His mother actually ran diet clinics. So he remembers even being a toddler being put on diets, being put on this diet and that diet all the way through his childhood. His mother had him on various diets. But what happened to him is the same thing that happens to everybody when they just try to diet. They lose weight and then they gain it back. He would lose 40 pounds and gain 50 pounds. He would lose 70 and gain 90. So through a lifetime of dieting, this landed Mike in his mid-30s in the upper 300s. It had gotten to the point where it was interfering with his job. He owns a big construction company here in San Diego, and he's a very hands-on manager. He was getting to the point where he physically couldn't walk around the work sites. He couldn't help his workers. He couldn't physically do his job anymore. And he found out that his business was kind of failing because he just couldn't physically keep up. He was sick with a great number of diseases. He didn't want to talk to his wife about it. He didn't want to talk to his doctor about it because he knew that the problem was his obesity and he didn't want to be nagged at about his weight anymore. But finally, he came to me, not because of his business, not because of his health. He actually came to me because he wanted to be a better dad. He came to me because of something that his little boy did one day that made him realize, I have to be a different kind of dad to this little kid. And you should watch his video interview on my website because he does a much better job at telling the story than I ever could. But let's get to the after pictures where you can meet his little boy who actually motivated him to have the surgery. And now his little boy is a teenager, and he, I think, would say that he was a very active dad. He had the kind of relationship and continues to have the kind of relationship with his son that he could only have if he was in a healthy body. And that's very meaningful for a lot of my patients who are parents and grandparents. They want to interact with their kids in a meaningful way because you never get those years back. Sleep apnea is a hidden killer amongst people struggling with their weight. Sleep apnea is when you intermittently hold your breath when you're sleeping. You don't realize you're doing it, and that's kind of the scary part about it because people don't realize that they're doing it. It's typically a snorer, and people snore more loudly and more deeply, and then finally they hold the breath for maybe 30 or 60 seconds, sometimes even more than a minute. But what's happening is that every organ system in their body is suffocating, like someone's holding a pillow over their face. Then they suddenly gasp for breath and they start to breathe normally again, and they cycle through time after time after time. Sometimes hundreds of times per night, they'll intermittently suffocate and they have no idea that they're doing this. So what is the effect on the body? Well, it causes irregular heartbeats, which is heart arrhythmias. It can cause stroke. It can cause sudden death because people sometimes just don't wake up from when they're holding their breath. If you have people in your family and prior generations who struggled with their weight and just kind of died in their sleep, this is a leading cause of that. It also causes hypertension and it causes weight gain. The statistics are on the slide. If you're 100 pounds overweight and you're a man, 98% chance that you have this. If you're a woman, it's 93%. So of course, the vast majority of patients who come to me wanting surgery have sleep apnea. But interestingly, it's the number one thing that I discover in patients by testing for it that hasn't been previously diagnosed by patients' primary care physicians. The number two thing is diabetes. The sad and dreadful part about this is that people don't know they have it and they're walking around like time bombs. Gastroesophageal reflux disease, this is just fancy doctor talk for heartburn. It's when the acid that's made in the lower part of your stomach that's there to help you digest food rolls upstream into your food tube, which is your esophagus that connects your mouth down to your stomach. The acid doesn't belong in your esophagus. It happens when you lay down at night, you don't have gravity keeping the acid into the lower part of your stomach, and it starts to roll upstream into sometimes way up into the back of your throat. And it can actually tip over the little valve in the back of your throat and go down into your lungs. So now you have hydrochloric acid pouring into your lungs, which causes bronchitis and asthma. But just the acid exposure in that food tube in the esophagus over time can lead to Barrett's esophagus, which is a precancerous condition. So a little bit of heartburn over time does cause a lot of trouble for people. Certainly men and women face different issues when it comes to struggling with extra weight. A lot of it is hormonally related. Erectile dysfunction, very common amongst men. Cancer of the prostate and the breast. Breast cancer in men is on the rise because fat on the human body, whether you're a man or a woman, makes a chemical that is very similar to estrogen. And your body thinks that it's estrogen. So what does excess estrogen do? It causes breast cancer in men and women. It causes uterine cancer in women in the inner lining of the uterus. It also causes polycystic ovarian syndrome. And that's where basically this estrogen is at very high levels. It throws off the normal balance of all the normal hormones that a woman should have, and a woman forms sometimes very painful cysts on her ovaries, but the bottom line is she doesn't ovulate properly. So she doesn't have normal menstrual periods. She has very painful ovaries, but doesn't have fertility. This is Autumn. Speaking of infertility, she had had 2 children and she wanted a third, but the baby weight from her 2 children made her infertile. She was speaking with her aunt and uncle, Bob and Sandy, whom you'll meet later in the lecture, and they said, well, maybe you should talk to Dr. Elner. Maybe your infertility can be fixed if you lost some weight. Maybe you qualify for surgery. So she came to me and she did qualify for surgery. And here's an after picture of Autumn only 5.5 months after her surgery. We have side shots of Autumn as well. She's absolutely gorgeous. And we have the back shots, and she's only halfway through her first year here. So that's at about 5.5 months. Here's Autumn at a year after surgery. But the point is, look what happened. Number 3 popped up. So her fertility came back very quickly, and she was able to have her 3rd child. Now look at this picture. Her new little baby doesn't look very old. It's only a few months old here, but look at her. She has no baby weight on her. People ask me all the time, how does this surgery affect fertility, and how does this surgery affect my ability to have a healthy pregnancy? As long as you wait at least a year until all the weight is off, then you get pregnant. It's actually safer to get pregnant after surgery than it is to get pregnant and try to carry to term when you're struggling with extra weight, because then you're a high-risk pregnancy. You wait until the weight loss has happened, then you have a healthier pregnancy, and it's healthier for you as it is for the baby to have the pregnancy after weight loss from surgery. Arthritis. This is the most common reason why people come to me saying, I've had it. I can't live like this anymore. I can't live with the pain that's getting worse and worse and worse every day. The over-the-counter pain relievers don't work for me anymore. I worry that I'm going to lose my job because I can't be on my feet all day. My back is killing me. It's typically in the weight-bearing joints. It's the hips, knees, ankles, feet, low back. I operate on a lot of patients who work at Costco because they're walking around on those concrete floors all day. Same thing with Home Depot. And I operate on a lot of people who are just kind of stuck in one position. Even people who are stuck behind a desk all day, the back starts to hurt. But overall joint mobility affects every single minute of our day. It's what keeps people from exercising the way their doctors are nagging at them to exercise. And it does get to the point where over-the-counter pain medicines don't work anymore, and people need to start using muscle relaxants and narcotics just to get through the day, just to live a normal life. And they come to me saying, I'm worried that I'm going to get addicted to these narcotics. I don't want to live like this. I have to lose weight in order to not be in pain anymore.